Hi, and welcome to Home Care This Week. We have talked in the past about people wanting to maintain their independence and wanting to stay at home even as they age and as seniors get older, wanting to stay in their home as opposed to going into nursing homes. However, the number one reason that people go into nursing homes, and as a result something that they should be really working on preventing, is falls. It's not diseases, it's not any of these other conditions, it's slips and falls. And the home environment is where these things occur. And so it's something that people need to consider and to look at and to say, okay, I've got to look at this home environment as a potential disaster waiting to happen and try to prevent it. Preventing that will prevent people from having to actually land in a nursing home and lose that independence that they absolutely crave and really want. So home safety is a big, critical, important element when we assess a situation with a family and their loved one who is a senior. And so I sat down with Natalie Tate, who's one of our case managers, to talk about that and what are some of the things that she looks for and she talks about with these families, and here's what she had to say. So I know that often when I'm at home or somebody's at home and just kind of dealing with the regular household items and chores and things like that, I don't necessarily think about the slippery rug in the bathroom and the small little crack on the pavement as I'm walking up, or the kind of shaky hand railing or something like that, or missing railing or something like that.
Right.
I don't always think about that. Are those some of the, what kind of things do you think have you seen in the house? And
you know, it's not just only in the house. It's around the entire area that they are converging in. They are walking around in. Even recently in one of the most beautiful, senior living facilities, the handrail's loose. So, and we've already discussed this with the owner of the house. We dropped by and, it doesn't get accomplished. Do you go to the security office? Do you talk to, one of the workers that are walking around? Well, when you're walking into your own home, people, they don't realize that something tiny could land them in the hospital, and it's serious.
But
it can be carpeting.
But people want to do it because it's unsightly, right?
Yeah.
It doesn't, is that the...
You know what? There are a lot of reasons why people, I don't want to change. Yeah, I've done this. My house has been like this for 20 years, but what we really find is that I never thought about the fact that she has a walker and, we can't get around this, and that you come up and suddenly 3 stairs up a walkway. It's a huge problem. Do you get a ramp? What are we doing here? How are we going to get this person who's got ambulation issues up these stairs?
Watching a person just go around a corner, right? I mean, there's the chair that is the easy chair is always there for years and years, but because there's not enough room, she's lifting up the bottom.
Absolutely.
Right, as opposed to making it go, wheeling it around, and just something as simple as moving that chair.
Clipping on it, hooking it, falling down, hurting their hip. Ending up at the hospital. The easy chair is an interesting one too. A lot of people are unaware that there are recliners that actually lift people up. They can be purchased very inexpensively. There's also just a device that will sit on a chair and lift you. These
or
are
poles to help
absolutely.
assist up.